What are the glaucoma treatment risks? The risks depend on the glaucoma treatment that we've recommended to you. The risk of medical treatment will depend on the type of medication that we've recommended to you. Taking eye drops in general, people can sometimes experience side effects such as a gritty sensation or a stinging sensation when they put the drops in. Some more general side effects are important, and that's why we take a thorough medical history before we decide on the medical treatment appropriate for you. So for instance, if you have asthma, we sometimes would avoid using certain drugs because it can interact with your medical condition. Glaucoma laser treatments, that's a different question. The risks associated with that are, is there going to be a reaction to the glaucoma, to the laser treatment straight after the treatment? So for instance, there can be a short-lived elevation of eye pressure immediately after the treatment. And that's why we monitor you before you go home to make sure that we protect you from that particular risk, and we have therapies that we add to your laser treatment if necessary. The risks associated with glaucoma surgical treatments are different as well. All forms of eye operations will involve an element of risk. Albeit uncommon and rare, these are risks that we should explain to you before you undertake this sort of treatment. And they include things like infection, bleeding within the eye, or changes in your vision. The thing about all of these risks are that they're very uncommon. They're all treatable, but sometimes they can result in some change in your vision that can be an irreversible change in your vision. So it's important that we talk you through all of these risks before you agree to proceed with that treatment. As far as glaucoma trabeculectomy surgery is concerned, one of the biggest operations that we do in glaucoma surgery, there are risks associated with the control of the eye pressure, and that's why we monitor you in clinic for the first 3 to 4 weeks after the glaucoma operation to make sure that we identify any of those problems if they were to occur. Whilst these risks are uncommon and treatable, it's important to remember that the reason why we're recommending this treatment to you is because we want to slow down the visual deterioration induced by your glaucoma. And once this deterioration has happened, it's irreversible.